Let's go through some of these symptoms that someone might have if they have PAD. We have a graphic that shows us the warning signs, and if we can discuss these a little bit. You mentioned pain in your leg, tiredness. Dr. Fernandez, what are some other ones that we might be experiencing?
Sure. One of the things you want to look out for is the fact that it's intermittent. So it's pain in your legs that disappears after a few minutes of rest. What does that mean? The patient goes for a walk, he or she can almost predict the distance at which that pain is going to come on. They stop, they stand there, and the pain goes away. If you're experiencing tiredness or cramps in your legs when you're walking, these are also other ways that patients may describe it.
Right.
I'm not talking about the cramps that wake you up in the middle of the night. That's a different, this is a description that the patients may give you. I get a cramp when I walk.
Right.
So as a physician, we need to have a high incidence of suspicion. Now, if you have patients who have peripheral arterial disease and they also have diabetes, your patients may be experiencing some numbness or tingling or coldness in the legs. We're going to talk a little bit more about that. That's peripheral neuropathy. But again, these are things that you want to have in your mind. Slow healing ulcers or sores or infection in your feet. If you have patients with diabetes, that comes in. Pain in your feet or your toes, even when you're resting, also should alert. You've got to go get checked out.
And it's good to know that it's important to know, though, that these symptoms, they can all happen, or you can only get some.
That's exactly right. If we rely on, and I think we talked a little bit about it before, and I believe we may have a graphic on it later. If we rely only on identifying the patients that have symptoms of peripheral arterial disease or the intermittent claudication, we're only going to find a minority of those patients.
Right.
Majority of our patients do not have any symptoms whatsoever.